UNFPA Rwanda has spent the last 2 weeks engaged in sensitization campaigns working with partners to highlight the importance of respecting the rights of women and girls during this time of the COVID-19 pandemic. Men are sexually assaulting us and getting us pregnant, only to deny responsibility for the babies, and then they refuse to help us care for them. We work to feed them, and they repay us by denying that they are the fathers of our children, leading to problems down the road, school fees and dropouts, all because they raped us. During this coronavirus period, many people have gotten pregnant and it is a burden to them. Bringing a child into this world without first thinking about what you are doing will always have consequences. They are being sexually assaulted and becoming pregnant every day. Many babies will be born come January. Married couples are doing it non-stop. Parliamentarians are sounding an alarm on the issue, saying it is certainly not a laughing matter when you consider the consequences that are bound to follow if nothing is done. It is very possible that some women are pregnant because they were too afraid to go to hospital to seek family planning methods, afraid that they would get infected with COVID-19 while there. Others could have been manipulated into sexual intercourse during the lockdown and not reported it. Certainly, there could be cases of gender-based violence we have no way of knowing about. I therefore ask people to think of the consequences of their actions and impact such conduct can have when it comes to reproductive health in general. We must remember that proper family planning is always necessary and that unwanted pregnancies are to be avoided because of the negative impact they have on the development of the family unit and the economy. UNFPA is warning that the COVID-19 pandemic's effects are going to be felt far into the future in many different ways, and the sexual assault of girls and women during the crisis is far more serious than most realize.
The COVID crisis has taken a staggering toll on people, on communities, and economies everywhere. Yet not everyone is affected equally. And as we often see, women and girls tend to suffer the most. The impact of COVID-19 will change global efforts to achieve the 3 zeros at the heart of the work of UNFPA. 0 unmet need for contraception, 0 preventable maternal deaths, and 0 gender-based violence and harmful practices against women and girls, all by 2030. Together, let's put the brakes on COVID-19 and safeguard the health and rights of women and girls now.
Rwanda's population stood at 3 million in 1966, doubled that in 1988. It again doubled in 2017, and as of last year, it was 12.3 million people, 60% of whom are youth, and 40% of those young people under the age of 15, the remaining 20% between the ages of 15 and 24. Rwanda's population has increased at an average of 2.6% in the last decade alone, and at that pace, the country will have more than 21 million people in 2041. As for gender-based violence, 4 in 10 females between the ages of 15 and 49 have been assaulted in some way by their spouses or other loved ones, and the consequences are always worse for girls compared to boys due to the risk of unwanted pregnancies, early marriages, more children down the road, and a potential population explosion.